Welcome to a tour of the Clinic of Emergency Medicine in Hrvatska Kostajnica. We will start off with our outdoor equipment and the ambulance. Inside the ambulance, we carry 3 bags. A medical bag, a reanimation bag, and the optional nurse's bag, which is the backup to the medical bag. This Peugeot Boxer was bought in 2016, is a 4x4 and has a minimalistic setup by MS Design and has containers for only the few necessary items as all the equipment can be located in our bags. The front of the medical bag contains a sphygmomanometer and a stethoscope, a blood glucose test, and a pulse oximeter, all the things needed for vital signs. As you open the bag, you will notice the ABC setup with access to airways at the front. After breathing is established, circulation equipment is readily available. The green pack contains gloves and masks, the blue pack is for diagnosis, and the red pack is for wound care. The yellow pack contains a craniotomy kit. Our medication is organized by ailments from head to toe. Benzodiazepines, antipsychotics, pain medications, and their antidotes are on the first page. Antacids, spasmolytics, and other GI medication are included in the second page, as well as antibiotics for gram-positive and gram-negative bacteria. The center pocket holds pills organized into ACS, circulatory, stomach and allergies, bronchitis and asthma, and pills for psychoses. The third page contains medications for lung function and breathing. The medications for allergic anaphylaxis can also be found here. The last page contains medications for circulation and heart arrhythmias in a non-emergency setting. And finally, in the pocket, there are ampules of glucose and glucagon for hypoglycemic cases. The front pocket of the reanimation bag contains an airway kit. This contains a few sizes of eye-gel, nasopharyngeal tubes from pediatric sizes to adults that are conveniently labeled with tags, a McGill's forceps, laryngoscope, lubricating spray, lidocaine, and a holder for the airway that you choose to install. As you open the reanimation bag, you can see the airways are conveniently located. If the person is not truly in an emergency situation or needing intubation, such as an epileptic attack, this bag is designed to be convenient to the nurse and the doctor during the reanimation and placed at the patient's head if possible. The nurse will be on the right side of the bag, which will have access to these IV lines. The third person or driver will start CPR as the doctor sets up a secure airway and starts ventilating. There is also a pediatric kit, and all the equipment and miniature sizes can be found there, and a pediatric tape is easily located in this kit to measure for dosages. The blue bag is an IV starter kit and can be tossed to the nurse or used to open a second IV line on the doctor's side. The red bag contains an intraosseous bone gun if IV lines are not found within 90 seconds. The 2 black bags contain medications for the scenarios after a quick look. If a sinus rhythm is found and other reasons for unconsciousness is suspected, there are antidotes to morphine and benzodiazepines and medications for tachycardia or bradycardia. The black bag with reanimation on the front has medications for ventricular fibrillation or tachycardia without a pulse, and for pulseless electronic activity or asystole. The dosages are set up to a maximum dose and to a 45-minute reanimation time. There are also 2 ampules of magnesium for torsade. On the other side of the car, we have our trauma equipment. This includes a KED, a spinal board, transfer chair, vacuum mattress, and all the belts to hold the patient stable. Now, welcome to our clinic, the Hitna ambulanta in Hrvatska Kostajnica. Here we have the waiting room, and to the right we have our office, where paperwork is printed and filed. This is usually where the drivers do their work and prepare for non-emergency patient transport. If there is a rush, however, a nurse can take patients in this room and measure their vitals while entering them into the system. The doctor will be usually working at this desk in the clinic, where he can interview the patient and take vital signs. The clinic is set up ergonomically to be as easy to the patient as possible. Our medical cabinet in the clinic is organized like the medication bag, from head to toe and by ailment. These are infusions that are ready to go. And there's also a notice board with dosages, so we can quick reference if needed. Medications that require refrigeration are located in the refrigerator. There are also 2 saline solutions at 4 degrees Celsius to bring down a high temperature, or for ROSC. These drawers and cabinets contain all our equipment and are organized by ABC. This is where most of our medication prep work is done. Next to it, there's a blood glucose test, there's also a sterile kit for suturing, and next to it, there's a station for inhalation. Most of the treatments will be given here. Next to the bed, we have our safety equipment, and most of our cases are wound care, so there are sterile gauzes and equipment. Our EKG is next to the bed and is ready for at any time in case of arrhythmias. We have a crash cart that consists of a defibrillator, an aspirator, and all the equipment to secure ABC and to start reanimation. Behind the clinic we also have a storage area. This contains our tissue papers, our spinal board, oxygen, and double down equipment of a vacuum mattress, trauma equipment, and also a gurney. Since this is a 24-hour facility, the team has to sleep. The bathroom and shower are located to the right, And this is the doctor's quarters, where every doctor has their own personal space and cabinet. Right next to the doctor's quarters, there's the nurses, and the setup is pretty much the same. Coming out of the living quarters, we have a living room area to the right. This contains a couch, a TV, a place to eat, our equipment for our interventions, some notice boards, and a fully stocked kitchen where we can cook, eat, and relax. Thank you, and I hope you have enjoyed the tour of Hrvatska Kostajnica's emergency medical clinic.